It is understood that 911 is for emergencies, but emergencies mean different things to different people. For some people, chest pain with "I can't breathe" is an emergency, but for others, the simple knowledge of what to do when their body hurts and they're just not feeling well and they don't know why is an emergency for them because they don't know exactly what's going on. The calls that we see during the season that are really going to be high volume for us are going to be some of our flu-like symptom calls. We're strongly recommending that everybody gets their flu shot, and when I do talk to the patients on the phone, one of the things that I ask them is, have you had your flu shot? I imagine we're going to see a lot of children with fevers as the children pass around everything that they have, from strep throat to the cold to the flu. And then of course we have our winter visitors, and they have issues that range everything from their underlying problems. Maybe they did a 3-day haul from where they live to here, and now they're feeling a little bit of short of breath, or their back's a little bit tight, or they're having some other symptoms. So the Nurse Triage program is a new program we've started up within the fire department that operates out of the dispatch center. The feeling is that having a nurse available in the alarm room to talk to patients before a unit is sent out would allow the callers to be able to better determine what is going on with them by speaking with a medical professional and help them define whether or not they were really something that needed a fire truck or something that maybe they could handle at home. It is a central part of what the fire department does. When a patient calls 911, of course they're calling because they don't know what's going on, they feel miserable for whatever reason they're calling 911. So our call takers, who are very, very good, go through a series of questions. And if they meet the certain criteria in their interview question and answer process, then they tell them, we have a nurse available who can talk to you. When the call comes to me, I go through a series of triage questions. I start with how they're feeling now, how does this relate to their underlying conditions, what have they done so far for it, and then do they need to see an advanced provider? So then I can go ahead and request that a unit be sent out, and we can request any level. We can request community care units which have advanced providers such as nurse practitioners and physician's assistants. We can request that an engine can respond but not with lights and sirens, or we can have a fire truck respond with lights and sirens, an ambulance to go out behind them, and be there in a quick, timely fashion to take care of what may have been sound a minor thing to start with, but actually turned into a little bit more once I've gotten through and done a little bit more thorough questioning with them. Having the availability of someone who can take the time to talk to a patient is really helpful to patients and to the community as a whole, because what they may identify as an emergency may not necessarily be an emergency that requires an emergency room visit. But perhaps it's something that maybe with the right education, the right direction, the right explanation as to what's going on will help them be able to manage their care at home on their own, as opposed to having to go to the emergency department, incurring a cost with an ambulance ride. You're getting medical advice that's been vetted by physicians through the program that we use and through our medical director, so that you know that the information that you're getting is good, accurate, thorough information, and I'm really pleased we've been able to start it up.